Okay, today I'm going to be showing how to do suctioning on a pediatric patient. So first I want to start off by going into the patient's room, letting them know what I'm going to be doing, make sure we have the right patient, do all of our checks and all of our stuff like that. Then I'm going to make sure I have all my equipment, and I'm also going to make sure I'm wearing a mask and a gown, and also put a towel around the patient so there's no secretions or anything during the suctioning. After that, we're going to want to make sure that we turn on our wall suctioning. So our wall suctioning would be behind the patient's bed. Since it's a pediatric patient, we are going to set that to 100 to 120. And we're just going to turn that on, make sure everything's working correctly so we don't have to stop in the middle of suctioning and everything. After we've done that, we are going to open our sterile kit. So I have my kit right here. It's sterile, so we're going to just be sterile. First, we have our little box where we're going to put our solution and saline. You're going to open this by not touching the inside because it's sterile, so you're just going to open it like that. And then we have our sterile gloves. During the procedure, we want to make sure that our dominant hand is used as our sterile hand, and the non-dominant hand is the one that we're going to be using to do more of the invasive stuff. So now that I have my sterile gloves on, I'm going to pick up my catheter and pre-measure. For the nasopharyngeal, we are going to do it from the nose to the earlobe, which is going to be about 3 to 4 inches. And once we've measured it out, we're gonna coil it up in our hands so it doesn't get loose and go everywhere. And then we are going to coil it with our dominant hand. And with our non-dominant hand, we are going to connect it to the suctioning on the wall. And we're gonna put it in our sterile saline. This is gonna be used to lubricate it. And once we've done that, we are going to take it and insert it. And while we're inserting it, we are going to rotate it just to make sure it gets to the right spot. And we're going to advance the catheter to the pre-measured length, and we're going to apply suctioning. We're going to have the patient turn their head from side to side just so we can get each side of it suctioned. So after we're suctioning, we want to make sure that we're suctioning no longer than 15 seconds. And we also want to make sure that we're allowing breaks in between. And we also want to make sure that we're not exceeding 5 minutes for the suctioning. So after we've done on that, during each time you suction, you can re-lubricate the tubing. And we're going to take off all the suctioning, make sure everything's placed correctly. If they were receiving oxygen, we want to reconnect their oxygen. Make sure our patient feels okay, ask them if they have any questions to let us know. And we're going to coil the catheter into our gloves as we take off our gloves. So our catheter would be in here, and we just kind of take off our gloves so we don't contaminate anything. And then we're going to dispose of all of our stuff and put our patient's call light next to them, and that's it.